Fortunately, colon and rectal cancer, you don't have to wait until you develop symptoms to get checked for it. So this is basically the screening. Screening, you don't have symptoms, but we're trying to identify patients and make sure we prevent them from getting colon and rectal cancers. So there are several types of screening modalities for colon and rectal cancer, starting from less invasive to colonoscopy. I would say really the main standard would be colonoscopy, and it's the one that you may have heard about. It's an exam where we visualize the entire colon and rectum, which again is the last 4 to 4.5 feet of the bowel, looking for polyps, little tiny growths that you don't know you have, because when there's tiny polyps, you don't have any symptoms from them. So we're prospectively going in and getting rid of those before they have a chance to cause a problem. The less invasive options would be stool-based tests, and the most popular one, which you may have seen advertised on TV, which is the Cologuard exam. And that's actually looking specifically in the stool. You'll send a stool sample, and they're looking for DNA changes that may be associated with polyps. That test's done every 3 years. And then the regular old stool test where you're looking for blood is something that's done yearly. And usually your family doctor would be someone who would facilitate that. And lastly, virtual colonoscopy is something where you actually use CT imaging technology, and it allows you to be able to see the colon through X-ray approaches in order to identify polyps. Colonoscopy is something that, as current guidelines stand, the American Cancer Society and the American Society of Colon and Rectal Surgeons have actually reduced the screening age down to age 45. 50 used to be the classic number, but actually age 45 is now the acceptable age to start screening with colonoscopy or the other stool-based tests that I've mentioned. A lot of patients will have a lot of trepidation and fear about the exam, and really it's an unfounded fear. Certainly it's something that you may not have done before, and it's understandable to be worried about. But I would say that the actual procedure itself, about 10 or 20 minutes long. We don't do colonoscopies without sedation. You're going to get a sedation in a very controlled manner and safe manner so that you're comfortable during the exam process, so you have a good experience on the actual date. Most of my patients, actually, the hardest part of a colonoscopy is not the actual procedure itself, but the day before. Usually that involves fasting, so you'll be drinking lots of liquids, and then you'll have to do a cleanser, which is basically a very strong laxative the evening before in order to get the bowels clean. Once you get there for the procedure, and after the procedure you get a ride home, and generally for the rest of the day you just take it easy. We don't want you doing any serious work or strenuous activity, but the next day after you can return to your work and regular activities.